I'm Dr. Suman. I'm a consultant pediatrician at Ankura Hospitals. Jaundice is a concern for the newborn babies. A lot of parents do get concerned as far as jaundice is concerned. I would give three tips as far as jaundice is concerned. First, before that, let us know why jaundice occurs in babies. Jaundice occurs in babies. Most of the common reasons, 6 out of 10 babies will be having jaundice, and the most common reason would be the hemoglobin, the blood present in the baby, is usually mother's blood, usually gets destroyed within the first few weeks. When they get destroyed, this hemoglobin gets converted into bilirubin. This bilirubin has to be digested by the liver and then filtered out in the form of urine or in the form of stool. This is what naturally happens. Here the load is more, the baby's liver is too small. So sometimes when the baby's mother's blood group is different and baby's blood group is different, obviously there will be a lot of destruction and the liver has to do a lot of job. That's when this extra jaundice, extra bilirubin gets dissipated in the skin and presented as yellowish discoloration of the eyes, face, body and skin. The entire body gets affected. This is how jaundice happens. It's a very natural process. Usually the jaundice peaks on day 3 and ends by day 7. So there are 3 tips which we can do in house to take the best care of the baby. What are these 3 tips? First tip is keep the baby well hydrated by giving good amount of feeds. Frequent intermittent feeds. Keep the gut motility increases, the baby will be well hydrated. When the gut motility increases, the bile will be secreted outside. When the baby is well hydrated, what happens? There will be minimum dehydration and minimum destruction of hemoglobin. That's something which will help the baby a lot as far as jaundice is concerned. Second tip I would give is to so the mother should be feeding well. Mother should be taking good amount of fluids so that mother is well hydrated, then they will milk, adequate amount of fluids will always be present. Third important tip which I would give is keeping the baby in adequate temperature. So we should not keep the baby too hot and we should not keep the baby too cold temperature. Both these things can cause more jaundice for the baby. So we would recommend at a temperature which is ambient, means the room temperature should be comfortable for the parents who are standing there. They should not be sweating. At the same time, they should not be feeling cold, with normal wrapping, and see that it's not too hot, and don't keep the baby under a big hot light. The third last important thing is that there's a controversy regarding sunlight as far as jaundice management is concerned. It's a controversy. It is not accepted scientifically, though there is no harm in giving a safe sunlight, because sunlight will not have entire amount of ultraviolet light which is required for treating jaundice. What we need to do here is, simple tip is, between 10 to 4, keep the baby with the sunlight which is coming through the window for 10 minutes, not more than 10 minutes. Don't keep the baby directly under the direct sun naked. What happens is it might cause sunburn to the baby. It might also sometimes damage retina to the baby, also might dehydrate the baby. So some things which we need to keep in mind. Thank you.